Hi, everyone. Welcome back to the podcast. Welcome all new listeners, and welcome back to those who have heard my content in the past. If you want to know why it's not your job to say no, you need to tune into this episode. Before I go on to the podcast, what is new? What is better in life? I just celebrated a Father's Day recently, and it was pretty amazing. Someone asked, "What is what's the best part about being a dad, or like what's most memorable to you?" And I had to think about that for a little bit, but I would say one of the best things I enjoy is watching my kids grow and develop as a direct response to the things that my wife and I work on with them. So just that maturity, developing their logic, their like reasoning and understanding of the world and like why things happen. Like for instance, my son asked me, he's in a recent youth soccer camp, and he said, "Dad, there's some kids there that are mean to me," and he says, "I don't want to go anymore." And I said, the hardest part about life is that there's a lot of things that you won't enjoy, and some you have to be able to tolerate and push through, and some you can avoid. And this one's not one you can avoid. And this one you're gonna have to learn to, deal with people and manage them, and not necessarily like fight them, but also just not let it get to you. And so, he had to process that, and he said, "No, I understand, Dad." And so at the age of 6, he's already understanding like what the things he needs to be able to work through. And so I really appreciate that aspect of seeing the kids develop, and it's day to day, it's week to week. So that's probably my favorite thing. But what else is happening? My wife and I are getting away for a little while, a little time away. So excited about that. Kids are great. My daughter Alex is in jujitsu now, and she's loving that. So excited for that. And Jacob is just being the little spitfire that he is. So all's good with the Garcia fam. So all right, onto this podcast. Why are we talking about it's not your job to say no? And where does this come from? This was from a recent conversation I had with another sports physical therapist that I mentor. And what happens when we challenge our medical ethos? What happens when we really step outside the boundary of a medical provider or as a medical provider and say no? And I wanted to share what happened and why we're talking about this, because this is very applicable to your day-to-day practice. This is going to seriously impact 99% of the people that you see. And with one small adjustment on how you work with your patients, like how you say things, when you say it, and then how you approach them. And so I'm excited for you to be able to get some help in your clinical practice. So here we go. So why is it that we can't say no? We shouldn't say no as a medical provider. I think if you look at what we do, our job as physical therapists is to support and help people just live a better life, right? That's probably the easiest way to describe it. Like the only reason somebody's coming to see us is because their quality of life is affected somehow by a musculoskeletal pain, or else we really don't see very many people if that were the case. So we rely on people being hurt or not living a normal quality of life. And so we're just waiting, right? We're waiting for people to come at us and say, "Hey, how do you fix this?" And we're like, "Oh my goodness, I'm ready. I can totally do that." And that's your job, right? We can understand that your job is to help people live a better quality of life and do the things that they love. Now, in any form of medical practice, underneath that is do no harm, right? Do no harm. And somewhere there's a barrier, or excuse me, there's a spectrum of do no harm on one side, like just do no harm, and the other side is help people live a better quality of life. And I'm talking about everything in between those two ends of the spectrum. And so this comes off of a discussion about youth athletes, but it can be applied to adults and everybody else. So if you had a youth athlete that came to you and said, "Hey, my name is Richard, and I am having ankle pain from a recent ankle sprain, and I have a competition or a soccer tournament in 4 weeks, and it's a grade 2 ankle sprain, right? And you're the initial evaluation, you're in direct access, you get to see him, and they come to you and they say, and the parent is there, they're present, and they say, will I be able to play in 4 weeks? As a medical provider, I'll share a story about after teaching my my strength and conditioning summit over the last month, I realized a lot of clinicians, we jump to, it's not possible. It's not even possible. Now, I'm going to help you reframe that. And the way you break this case down is we look at the timeline, 4 weeks, right? Okay, 4 weeks is a little tight. Grade 2 ankle sprain. How long does it take you to rehab that? 6 to 8 weeks. Okay, so we have a 4 week timeline and we have a gap of 6 to 8 week recovery. So how are we going to close that gap? And one answer could be not even possible. Another answer would be, you know what, Richard? An ideal scenario is if you can wait to the 6 to 8 week mark and choose your next tournament. And Richard says, no, I'm not doing that. I need this tournament because my grandparents are going to be there. College scouts are going to be there, or this is the last game of the season. And so as a medical provider, you're torn. Oh my goodness, what do I do here? Because I have somebody who really wants to play. 6 to 8 weeks is ideal, but they're at the 4 week mark. How do you rehab this? Before you explain anything, you now have to work through, is this even possible in any form or fashion with modifications? So another entry point you can have with the conversation is, okay, so what would be the minimum that you would need to play so college scouts could see you enough on the field? So if they say, I only need 15 or 30 or 45 minutes on the field in a 90-minute game, how many minutes do you need? Well, half the game. Okay, 45 minutes. Now we're talking. So I know 6 to 8 weeks would be ideal to get you back to 90 minutes. Now I have half of that at 4 weeks. I think I can get you down to half the game. Now there's going to be a lot of modifications. You might need to be wearing an ankle brace. You might be needed to come to therapy 3 times a week instead of two. You might need to be more compliant with everything that you're doing at home. You might need to be doing, all these exercises and all these other things, and modified practices might need to be modified. So when you look at it on paper and you outline this, and you might have a patient you're working with, and you say, actually, I know at week 1, it's going to take me a week to get you rid of your edema. Week 2 is range of motion, a little bit of balance. Week 3 is strength. Week 4 is impact. So actually, I'll be able to get you to 15 to 30 minutes on the field, but that's all I can give you. And that requires everything be done. So you might be only 25 to 40% recovered to go back into that game. And Richard and their parent, who's right there in front of you, can then make the decision of like, okay, is that possible? Do we still need to buy the plane tickets? Do we need blah, blah, blah? Is that worth it to them? And that different option gives that player, gives that parent, gives that patient a possibility, right? So the clinician who says, no, you can't play, you just destroyed all forms of hope. You went from 0 to 100% no go. But we didn't even factor 25, 50, 75% possibility of even playing that with that much effort, intensity, duration, total minutes, blah, blah, blah. It could be basketball, it could be anything that you're talking about. Or it could be a CrossFit competition, it could be something that they're looking forward to. And I titled this podcast, it's not your job to say no. As a medical provider, we do no harm, right? So don't tell him 100% and he's not safe at week 2. Like that would be doing harm. So do no harm, but then also help people live a better quality of life, both physically and mentally. Physically, they might not be prepared to be in that game 100%, but you let them know that. Mentally, they want to be in that game. And if you say no from the beginning, you know how much trust that patients have in a physical therapist who's been practicing, doing all these things. They went through the whole medical system, or they found you and they trust you. It is your job not to say no, but to ensure that you're maximizing their physical and mental health going into the competition that they want, the quality of life they want back. So it's not your job to say no. It's your job to provide education and information on the safety and risks of them doing what they plan to do at the rate at which they want to do. So it's not your job to say you can't play. It's your job to say, if you play, this will happen. These are the risks. If you choose not to play and you can save it for another competition, that would be ideal. What would not be ideal is if you play, you risk re-injuring this, having a possible grade 3, and having lifelong problems down the road. Now that's at 100% return. Now, if we put you at 50% return and we keep you in a different position that is not doesn't have as much contact, maybe they're a forward or a midfielder that they run and sprint a little bit more, but maybe we put them at, right or left defender, maybe that has less contact. And your job then is to provide that option and say, here are the risks associated with that. With all that information, now they can make a decision on what they want to do. And let me flip this and say, what if it was your kid? What if it was your kid in front of you saying, Mom, Dad, I want to play in this game. Is it possible? And what do I need to do to get there? Now, you as a clinician might change your answer the minute it's your kid because you're like, oh my goodness, I know how important this is. How about we wait a week, see where your swelling is. We'll talk to the coach and see how important this competition is to them. Can they put you in a position that's going to be different? How much time does the coach need you in there? Is it too much risk? Now you're working all the system. Now you're trying to find all the avenues that would allow your child to be more successful. Is there a brace that I can do? Is there better cleats? Is there what type of surface are we playing on? You're looking for every entry point that would put them at risk for more injury. Now, say for instance, you took your same kid and you weren't a physical therapist and you went to a physical therapy clinic and they were like, "Hey, we want to play in 4 weeks," and the physical therapist says, "Not possible. You can just take your bags and pack them now. It's not possible." Well, they just destroyed all your hopes. And you know what those parents are probably going to do? Find somebody else who's going to help them. So you always have to think about, what's the consequence if I say no? What are they going to say? Fine, we'll go somewhere else. Or do something. We'll listen to somebody else. I don't know. We'll figure it out. And you, as a provider, have done harm to the profession because your reputation is now telling the community that PTs will say no. And that's not what we're trying to do. Our job is not to say no. Our job is to help facilitate with the lowest risk of injury or re-injury to get you back to doing whatever you want to do. You can't tell me if you had a marathoner with knee pain and they had, patellofemoral, and they ask, "Hey, I have a competition in a week," and they're in severe pain. What if they say, "It's the thing I want to do one time in my life. I've been training for 6 months. I'm not doing this again." You would likely help them try and figure out any form of modality to set you down for 3 days, give you all the modalities, get you all the treatment, get you all the tape chop, get you all the bracing, get you everything, all the modifications, new shoe wear, whatever it is you're going to do. You would try and figure it out. And that's what a good physical therapist does. It's not about saying no. It's about finding out, what are the risks? How do I do this with the least amount of risk? Give them the options. Ideal, not ideal. This is what I would do. And one of the best statements that I tell physical therapists who I mentor is, frame it before you make a decision on what you're about to say. When somebody says, "Is this possible?" What you need to do is ask yourself, if this were my kid, if this were my aunt, if this was my parent, how would I change my answer? And if it was your parent and you would have a different answer, why are you giving the public any different response? When in reality, you should be like, listen, here's the possible scenarios. This is a high risk. This is lower risk. Somewhere in there, you can do it modified. You're going to have to do this, this, and this. And honestly, if you were my parent or you were related to me, or you were my uncle, you're my aunt, you're my brother, or you're my sister, that's what I would tell you too. And they would appreciate that. Why? Because you're being authentic. You're not being some uptight, physical therapist who has a doctorate degree or whatever, accolades you have, or done a residency, you have a fellowship, you have certifications, up the yin yang. Nobody cares about those. Those don't matter to anyone. Those only matter on how you apply it to the public because all they want from you is education and information on what's the safest route for me to be able to accomplish this. That's it. They don't care about, well, research shows. You can tell them that, but tell them how that impacts their risk and let them make that decision. It's not your job to say no. And the reason I know that physical therapists do that after, I've taught CEU courses for over the last decade. And most recently, this was a good one that we had, a good conversation we had at my strength and conditioning summit. We bring up any of my courses. I'm excited to see you in any one of my courses, but any of my courses, I'll bring up tough case scenarios that I see in professional athletics, elite sports, direct access, you name it, where if you work in a traditional clinic, you might only see people from 4 weeks to 4 months, depending on the insurance provider. And when you get things that are shorter than that, or they want to compete in 5 weeks and it's a fresh new injury, you really have to work through what are modifications, what's going to happen at week 1, what do you do at week 2, what's so different at week 3, when do you introduce practice, when are plyos, when you start strengthening them, how do you keep your fitness going? I mean, all these variables that you can be doing and maneuvering outside of I don't know what exercise to give you, so I'm going to tell you it's not even possible from a healing perspective. And I know that people do that because I'll always open up with good case studies on the courses, and people work through them and they're like, oh, it's not possible, not possible. And by the end of the course, we map it out. We do a whiteboard session, and they're like, "Oh, yeah, but at week 2 we can introduce these and then these and then this." And I say, at the start of the session, everyone's saying it's not possible. It is possible. It's just the tools and how you look at the scenario. There are ways that you can get people back to sport faster than you would dream or be ideal. Or, somebody comes in with a rotator cuff tear and, they want to get back to the gym at month 4 or 5. And you say, listen, here's the risk. I wouldn't do it. If you were my brother, my sister, my aunt, my uncle, I would tell you the same thing. I'm looking to protect you. I don't want you to put this risk. And if you do, it's on you. And I want you to know that it is not safe and I would not recommend it. That is your job. Your job is not to be the dictator and say, no, I've earned this degree, so you have to listen to me. People don't like that. They're adults, they're free to make their own choices, and people want support. Now, there are going to be cases where people want to say, you give them options, they're like, you tell me, what would you do? And that's the fair discussion. Say, I wouldn't do it. I wouldn't do it. If there was my kid, wouldn't do it. It's too risky. And I've had multiple conversations like that with parents, patients, whatever it is, all ages, 70-year-olds, 70-year-olds who want to have participate in a track and field event, 70 years old, 70s who are doing softball, triathlons, whatever it is. And my job is just explain. Here's what's gonna happen. And I can tell you, but I've been practicing a long time. You're gonna see this on the back end. You're more than welcome to make that decision. But here's what I'll tell you. So that's what I want to share with you guys. And if you're struggling with these cases, or you like having the ability to navigate these types of conversations of what would you do, how would you do it, what's the latest research say, and how do I put that into my practice, how does it guide me? I feel like I'm hitting a wall or a block in my practice. I don't know what to say next. I have all these people who leave and don't come back, and that's really the downside of doing these things. You lose patients, you lose their confidence, you lose their trust. And you might say, well, like I want to work with more athletes and active people. This is how you approach them. Active people don't want to be told no. Active people want to decide how much to push and pull, how conservative or aggressive they want the rehab to be. And when you get that type of a patient, that's a great relationship because you're like, I'm helping you and you're genuine, you're authentic. You're not the dictator, the white coat syndrome. You're not that person. And today's patient wants a very practical clinician who can help them along the journey, and they will continue going back to you for life, for all the new injuries they have, the elbow, the shoulder, the new thing, their parents, their patients, their in-laws, everybody, they'll come to you. And so if you enjoy these conversations, somebody asked me recently if I was going to be opening up more slots inside my sports PT academy, and I am. It's my online mentorship group that I have, and we meet monthly. And we literally bring you have an assignment to do every single month, and your job is to bring me your challenges, work through them, and I help you navigate clinical reasoning. What's the latest and greatest? What I'm hearing from all the sports PTs around the country and globe, and how to integrate that in your clinical practice. And this allows you to make smaller adjustments very quickly. Most clinicians wait to the next CEU course to figure out what's the next thing they're going to be doing with their practice. And so you and I both know that if you take a course and you take it for 2 days, you know what happens. You essentially use it for a couple weeks and then you're done. And so the reason I built a monthly online mentorship group was so that way you can have the progress every single month and not have to wait till 2 times a year. And that's the approach that CEU courses have, and that's the approach that dentists have. That it's great. They're almost just like check-ins, but the best way we all know and grow is by rhythmical, continuous progress, right? So, you've tried reading, journal clubs on your own, and you're listening to the podcast, and those aren't working, and it's a difference between really your ability to learn and grow. Those are two different things. Learning is listening, and growing is implementing. And podcasts and everything that you do is a lot of learning, but if you're not implementing it, it's not developing, it's not growth. And so if you're interested in developing as a clinician and develop your clinical reasoning skills and not just get more information to not use, then the academy is right for you. And so if you're interested, all the information is on my website. You can send me an email, drchris at drchrisgarcia.com. It's on my Instagram, Chris Garcia DPT, wherever you want. But ultimately, it's to support you along your journey and find where your next steps are and what you want to do and how you want to do it, and how to get more athletes on the schedule, why you're not developing, where you're stuck. And those are the conversations I love to have because they're very eye-opening for a lot of clinicians. Like, they're over here going right, and I'm like, you need to be going left because you are so skilled over here, but your weaknesses are here. And so to be a sports PT and manage athletes and patients, you're going to need to develop a whole new clinical skill set. So I hope that helps wherever you are, and you're trying to understand what should I be doing next. The academy is perfect for you. So if not, plan to attend my management of the barbell athlete course whenever you're listening to this. It's October 28th and 29th, both virtual and in person. That is October 28th and 29th. So if you love working with CrossFitters or barbell athletes and you want to know the mechanics behind everything, it's going to be a perfect course for you. All right. Otherwise, I will see you guys on the next episode. All right. Take care.